How do you decide when the patient's going to need the valve to be replaced or to have the surgery, or that's going to really be a big decision, a big change? How do you make that decision?
It's a great question. We don't want to operate too early. We also don't want to operate too late. So we tend to follow those patients fairly closely. For example, an echo every 6 months or so to determine the optimal timing of surgery.
So with an echo, it's going to tell you how much blood is going backwards, or how fast it's going, or how much noise it's making. What are you looking for?
Right. And also the impact on the heart. The heart can become dilated. So there are, and the patient may not appreciate that. That's not something they know about. But if you follow serial echoes, the heart can become dilated, the pumping function, the ejection fraction can become reduced. Those are all serious findings that tell us the person may need surgery.
Symptoms of mitral insufficiency or mitral valve prolapse?
Yes, sir. Shortness of breath is probably the most common symptoms. Shortness of breath. More severe would be congestion, where it's almost a drowning sensation. They can't lie down. They have to be propped up on pillows.
Surgery successful, mitral valve surgery?
It's very successful. The only thing is we don't want to wait too long. We don't want to wait too late, then it's more complicated.